When a resident of San Francisco is looking for health care, you look in your neighborhood first. What is closest to you? If you come to a neighborhood health center or clinic, you then have access to a system of care in the community health network. We are a system of care that was probably based on a family practice model, but it was really clear that there are special populations with special needs. The Cole Street Clinic is a youth clinic in the heart of the Haight-Ashbury, and they target an outreach to the youth in that neighborhood. Tom Waddell Clinic takes care of many of the Central City residents, and they have a great expertise in providing services for many of the homeless. The Trail Hill and Southeast Health Centers are health centers in those particular communities that are family health centers. So they provide health care to patients across the age span.
Many of our clients are working poor. They pay their taxes. They may run into a rough patch now and then, and what we're able to provide is a bridge towards getting them back on their feet. The center averages about 14,000 visits a year in the health clinic alone. One of the areas that we specialize in is family medicine, but the additional focus of that is to provide care to women and children. Women find out they're pregnant, we talk to them about the importance of getting good prenatal care, which takes many visits. We initially will see them for their full physical to determine their baseline health, and then enroll them in prenatal care, which occurs over the next 9 months. Group prenatal care is designed to give women the opportunity to bond during their pregnancy with other women that have similar due dates. Our doctors here are family doctors. They are able to help these women deliver their babies at the hospital, at General Hospital. We also have the WIC program, which is a program that provides food vouchers for our families after they have their children. They're up to age 5, are able to receive food vouchers to get milk and cereal for their children.
It's one unique thing about the city, not only our clinic, but the city. And we have all our children in San Francisco should have insurance now, because if they're low income enough, they might get Medi-Cal. If they actually have a little bit more access, a little bit more income, they can get heavy family. We do have family who comes outside of our neighborhood by visiting Valley to come to our clinic. One thing I learned is from our clients, no matter how old they are, no matter how little English they will know how to get to Chinatown, meaning that they will know how to get to our clinic. We are in this Chinatown since 1928. 85% of our staff are bilingual, and because we are serving about 80% of monolingual Chinese patients. One of the programs that we have in this clinic is we provide CPR and childcare courses for those childcare family giver to get licensed, so that they can be safe childcare provider to take care of our clients' kids, so our clients can go out and work.
We found more and more women who were of childbearing age come down with cancer, and they had kids. And the kids were having a horrible time, and parents were having a horrible time. How do parents tell their kids that they may not be here? What we do is provide a place and the materials and support, and then they figure out their own truth, what it means to them. I see the behavior change in front of my eyes. You know, maybe they've never been able to go out of boundaries at all, and their lives have been just so rigid. Just sort of catharting that and expressing that makes tremendous changes. And because we did what we did, it is now sort of a nationwide model.
I think you would be surprised at who comes to these clinics. Many of them, I think, would be your neighbors if you knew that. But oftentimes we just don't discuss that. We treat husband and wife, and they bring in their kids, or we treat the grandparents and then the next generation. So people come in who need treatment for their heart disease, or for their diabetes, or their high blood pressure, or their high cholesterol, or their hepatitis B. We actually provide group medical visits and group education classes, and meeting people who have similar chronic illnesses as you do really helps you to understand that you're not alone in dealing with this, and it validates the experiences that you have. And so you learn from each other. I think it's very important to try to be in tune with the needs of the community, and a lot of our patients are actually immigrants who have a lot of competing priorities, family issues, childcare issues, maybe not being able to find work or finding work and not being insured, and healthcare sometimes isn't the top priority for them. And so we need to understand that so that we can help them take care of themselves physically and emotionally to deal with all these other things that they also have to be working through. With people living longer and living with more chronic conditions, I think we're going to see more patients coming through.
Starting next year, every day 10,000 people will hit the age of 60 until 2020. The needs of the patients that we see at Curry Senior Center often have to do with the consequences of long-standing substance abuse and mental illness linked to their chronic diseases, heart failure, hypertension, diabetes, cancer, stroke, those kinds of chronic illnesses. When you get them in your 30s and 40s and you have them into your aging process, you are not going to have a comfortable old age. What we are also seeing in terms of epidemics is an increase in Alzheimer's, and it is going to increase as the population increases. There are quite a few seniors who have mental health and substance abuse problems, but there are also the majority of seniors who were hardworking, who had minimum wage jobs their whole lives, whose employers may not have paid into Social Security. Think about living on $889 a month in the city of San Francisco, needing to buy medications, one meal a day, hopefully, and health care.
If we could provide health care early on, we might prevent costlier care, and people would be less likely to end up in the emergency room with a drastic outcome. If we could actually provide prevention and health care to people that had no other way of getting health care, those without insurance, it might be more cost effective for the city.